This is the dosimetry report. This person is under the recommended limits, so they're at 830 and 34 millirem, which the yearly limit is 100. They also have on this report that this badge over here for this person is irregular exposure and over that, so maybe that person wore their badge outside. All right, we are going over a few things. We've talked about the dosimetry report, and now we're going to talk about time settings in x-ray taking. You want to take x-rays in the shortest exposure you can, not only because you want to end up taking less views to reduce your and your patient's exposure to the x-rays, but you also want overall less exposure to the radiation. The less radiation you're exposed to, even if it's as something as like a shorter MAS, is what's best for you, and will help prevent that scatter radiation from damaging your cells or causing any kind of genetic damage in the long term. Now we are going to talk a little bit more about shielding. So you wearing a lead gown or lead gloves doesn't mean you can be in the primary beam. The shielding only protects us from the scattered radiation. It doesn't protect us from the actual X-ray exposure. And that's why you can't be in the primary beam. The half millimeter, like half centimeter thickness of the lead gowns isn't enough to 100% prevent the x-rays from damaging you. It's only enough to protect us from the scattered radiation that is immediately coming off of the table in the patient once we take the exposure. Speaking of shielding, we're going to talk a little bit more about our shielding options. We have gowns here. They're associated thyroid shields. And then I have a pair of gloves over here that we have as well. They're the mitten kind. They do have an option for you to stick your fingers out, but that kind of defeats the purpose of wearing them. Because you want to avoid the cell damage to your hands, which can lead to like inflammatory disorders in your hands, it can lead to arthritis in your hands, and we all need to get a lot better about wearing them to protect ourselves, which can be difficult because we like to have our dexterity. That's why we like having so many fingers, but we want to in the long term keep those fingers, so we should really be wearing our gloves. We're also going to talk a little bit about our PPE too. We have goggles available to like the radiology department itself. I think they're individual right now just because of the sheer number of x-rays we're taking. So there's sheer number of exposure we're trying to reduce amongst each other with the pandemic. So I've seen radiology team members with the goggles, but I just don't think they're widely available to the whole hospital yet. And that's for helping with the scatter radiation being away from your eyes and it hopefully bouncing off of that. So we do have goggles available, and radiology takes the majority of our x-rays, so they have access to those things. They're just not left on the walls like the gowns because it's a little more difficult to clean them in between uses than the gowns. And then we're going to talk a little bit more about our positioning aids that we didn't discuss earlier. So we have foam wedges for helping elevate the sternum or the head if you're taking skull x-rays or the hind limbs. We also have wooden spoons for holding down paws and like being away from the table, as well as tape. There's that wrap too if we're doing something to keep the legs together. And there's also tape to keep the patients in place. And we have the troughs of various sizes. This is the one in this x-ray room right now. We're going to talk a little bit more about the contrast study we did, which was a barium study for an upper GI. Barium is a radiopaque solution that we can administer to patients in liquid form.
triage 2.
And so the procedure for that is we have our initial x-ray exposure, which may be suspicious for something. And then it might be beneficial to see, well, what is the motility of the esophagus? Is this patient able to swallow this full amount and it make it into the stomach? And so we administered the 20 milliliters of the barium. Ideally, you're doing this with the patient wrapped in a towel so that you can avoid the barium getting on the liquid getting on the fur, which would then potentially be in your exposure and would make it difficult to determine if this is truly in the esophagus or not, as well as avoiding getting it on the table itself, because you don't want to take an x-ray of something that's radio opaque right next to the plate where your patient's on top of. This patient had come in for playing with a bully stick and then like having choking behavior after that. Had a suspicious x-ray that the radiologist recommended a barium study for to evaluate for the esophageal foreign body. So we administered that 20 mL of the barium while he was upright. Then once he swallowed that, we took an exposure of the chest to evaluate the esophagus to see what the motion of like the esophagus was doing with this portion of liquid, and then took subsequent x-rays to see what the esophagus was going to do. Is there anything obstructing something in the esophagus and not making it into the stomach? This is our x-ray machine, one of our x-ray machines. This is the technique chart for this machine, but our program also automatically sets the exposure time and like the MAS and the KVP for every x-ray that we take, based on the patient's weight that's input into the program, which we showed in the video itself for the chest x-ray. But you can always double check the machine. So if we were doing the extremity like we did on that kitten for the craniocaudal radius ulna view, the machine was set to 52 and 7.5 for if we were using this machine. We did the VD pelvis on that patient where the settings were 80 and 6 as he was under 80 pounds. And then our thoracic rads were under 20, no, they were 80 and 3 because he was a little over 9 kgs. I think he was like 10 or 11 kgs, something like that. So the machine was set to this, which the computer knew to do because we input the weight for every patient that we take x-rays on, because they can communicate and do that for us. Now we're going to talk about setting an x-ray. So we'll see if we have a test in somewhere. No. So we're just gonna go search for all of them. We'll take we'll do one from yesterday. So we're gonna start a study. We're gonna put in 5 kgs. And then we're gonna select our views. So we're gonna pretend that we're doing these ones we took with for the assignment, but we're not going to take any exposure. So we've added the VD thorax, we're adding the pelvic rad of the extended VD, and we're adding a 4-limb radius craniocaudal, and we're going to hit select as the shot list, and then we would be taking our exposures. And then if you look at the machine, it's set to 70 and 3 for a 5 kilogram patient. And then if we hit the VD extended, 70 and 4. So we have the VD 70 and 4. And if we go to the extremity, we have 52 and 7.5, 52 and 7.5, which is really convenient and nice because then our machine is kind of calibrating its own technique chart. We can also talk a little bit about what we're x-raying. So this is really great because it tells us what our X-ray collimation points are. So we have our cranial border is the thoracic inlet. You want to have all of the body wall on the laterals when you're in the VD, and then your last being the ribs, or the first lumbar vertebrae, actually. And then we have our VD pelvis, which we have the wings of the ilium being the top of the cranial border, and then you want on your caudal border to be just caudal to the stifles. And when you're taking this x-ray, you're fully extending the forelimbs and the hind limbs. However, when you're extending the hind limbs, you're also rotating the stifles to be really straight. And then we have our craniocaudal left form radius. You want to be just cranial to the elbow when you are collimating, and then just caudal to the metacarpals. And you want to be able to pull that limb extended as far as you can so that it is straight. You want, unlike, I don't think the program's able to show you in the picture, but you want the head away from the view. So right here where this dog's ear is in the way, that would be less than ideal. You want their head away from the exposure, and so you would just turn it away. And then on the VD, you're also extending these limbs and straightening the head as best as you can so that you can align the spine, and then you also don't have the sternum superimposed over the heart. All right, and that I think is it.